Hi, everybody. Hi. Just three things just to remind you during our meetings to mute your microphone while the speaker is speaking. That way, if somebody gets a phone call or somebody comes in to talk to you, it doesn't disturb the speaker. Write down any questions you might have. For the speaker, and I'm sure there'll be a time when you can ask the questions. And then don't interrupt other members while they're speaking, and don't interrupt the speaker also. And just, that's the three Zoom rules. So take it away, Cindy.
All right. Great job, Cheryl. And welcome to our group meeting again. And I'm Cindy. I'm the president of the Fibromyalgia Support Group. I'm here to introduce Dr. Randy Houdek. He spoke to us before in the past about general eye care. And of course, he probably has more information to present to us today. So thank you, Dr. Houdek, for coming back to speak to our group once again. Hopefully soon, maybe we'll do in-person meetings. We're still thinking about it, right, Cheryl? It's so confusing. We have so many things to sort out, but we'll take it as it goes, right, guys?
All right.
All right. Go ahead, doctor. Thank you again.
Well, thank you, Cindy, for inviting me again and seeing everybody. Little small group today. And matter of fact, if you want to, they can put their speakers on it, because as I talk, some things I'll talk about and I'll ask questions. So we'll keep it pretty informal because we're a small group today. But if it's saying shutting your microphones off, if you want to shut your phones off, if you're on a laptop or something, just for the ring there. But this way we can converse and whatever. And basically, there's a lot of different things we can talk to. There's a couple of things I really wanted to hit on is a couple of new things that are on the market. And one of the biggest things that's hit the market lately is to try to reduce floaters in your eyes. And in the past, we've had nothing. And said, if you do this, there's not a whole lot we can do. If you get a lot of them, they do surgery. But there's a new vitamin mineral supplement through the company called MacuHealth, and it's called Vitreous Health, VITREOUS Health. You can probably look it up. They probably sell it at Amazon and everything like that. I think it's like for a 90-day supply, it's around like $65 or something like that. You take these, and it's a combination. The ingredients are zinc. The big thing is vitamin C. They have some grapeseed extract. They have some citrus fruit extract, and L-lysine are the main ingredients in that. And supposedly I've read the studies, and they have 70 to 77% decrease in floaters.
Wow.
Within 2 months.
Wow.
And it's a study out of Ireland. So if anybody's Irish there, you can. It's a study out of Ireland that came out in the end of 21. And they're now, it's now commercially available, and it's non-script too, so it's you can get that. Yeah, we're starting to look into it to see if we can get it and try to stock it here. So that's so anybody with floaters, that's a possibility that it could help.
I know I'm not supposed to ask questions, Jeff.
No, go ahead. Go right ahead and do
it. I take the AirEdge 2. I take that once a day for they found macular degeneration in me. Is this Vitreous Help similar to that vitamin?
The AirEdge 2 has zinc in it and vitamin C, but it does not have the other ingredients. So it's a combination of things. So you could supplement with this, because the zinc, we worry about too much zinc, because if we take too much zinc, we deplete our copper. Copper is necessary for nerve transmission, so we don't want to affect that at all. But the good news is the total amount of zinc that you would get between the two is still way below what we would consider any problems with taking zinc.
Because I have floaters as well, and I prefer, right now I'm taking only one of the AirEdge 2, because, I was just concerned about all the zinc the 2 tablets would be. So if I take this, so you take both of them, like one of each?
Correct.
Okay.
And because the zinc would be 25 milligrams, we're concerned at 200 milligrams. So we're still way below the rate.
Oh.
And if you look at the ARIDS 2, they do put copper into the ARIDS 2, just to kind of cover themselves. So there shouldn't be any problems with that at all.
Well, I'll have to try that because, I see all these swimming floaters all the time. As I get older, it seems like I'm seeing more of them.
As we become more mature, that happens.
All right, I'll have to check it out.
Yep, and that's
Thank
any other
you.
questions on that? And that's good to ask questions. You can go ahead and do that because I'll be going to different topics and jumping around. And if you have anything specific you want me to talk about, we can do that too. But I wanted to get that one. The other one, if I can put this up there and see it. If you've seen this, it's Tyvalia. This is a nasal spray for dry eye.
What? Oh, wow.
Okay. And the thing about it is what it does is stimulates you're going to love this, the trigeminal nerve. And that's part of our tearing glands are stimulated by the trigeminal nerves. So it's a nasal spray that goes up and it stimulates them. And we've actually getting some decent results with it. And people can use this instead of putting an eye drop in. Because again, what it's doing is it's stimulating your natural glands to do their job. And the best tear for you is always your natural tear. Because everything else we have is called artificial.
Right.
It's not part of your body chemistry. So everybody's tear glands do a little different chemistry. So this one is a nasal spray that you use. And this is prescription only. That we use. And some people say, hey, I don't like taking drops. Here's a nasal spray twice a day. Go ahead and put it in. And we're getting some really good results with that too. And the nice thing is they've got some really good programs for cost on that too, which is really good. So those were the two of the newer ones. And the third newest one is this is a drop. This is over the counter. Ivisia. And this has been, I think, the leading drop in Europe for the last 5 or 6 years for dry eye over the counter. If anybody uses Refresh Mega 3 drops in their eyes, Mega 3 has one little ingredient that nobody else in the States have. This has a lot more of it. And they said that's the secret. Now this is, we just got our samples in a month ago, I think. And I've already had a couple of people call me and say, hey, where can I get this? Where can I get this? And we're and saying, they really like it a lot. So you can try this. And this is interesting. It comes in a bottle that's non-preserved. And the neat thing about it is the bottle, when you squeeze it, it comes out a meter dose, and then you squeeze it again, and that dose goes in your eye. So you don't have to keep those individual.
Oh,
Good.
So it's one big bottle here.
is this widely available now?
Yeah, it should be available at every pharmacy. And I just matter of fact gave out another one today and we had some coupons for them too. And that's what the bottle looks like. And that's an eye drop that we're getting some pretty good results on. And I've had a few, and like I said, I had a few people call me. So those are the kind of the 3 newest things we've had that we can get and use.
And how often do you take that?
That you can do once or twice a day at the most, is what they're saying. But I tell people if you think you need it 4 times, go ahead. But that's fine. Yep, go ahead.
Oh, I was going to ask you, Doctor. Actually, it was a question for my mom too, if that's okay. What age should a person get cataract surgery? I know hers are still small, so if their vision starts to not be clear or blurry, that's when she's supposed to get the surgery, correct? Excuse me.
Yeah, excellent question. And people say that, well, I'm not old enough, not old enough. And I'm saying, how's your vision? And it's kind of like, when do you get arthritis? And, when were you diagnosed with blood pressure? And they're all different ages. And one of the youngest ones that had like an age-related cataract I sent out was 42 years old.
Oh, wow.
And I still remember him, he's complaining to him. Going, yeah, it sounds like he has a cataract. I looked in his eye and it was the minimal type of cataract. If he wouldn't have mentioned anything to me, I might not have mentioned anything to him. But it was dead center in his lens. So he's looking, that's the center spot he's trying to look through. And the kicker with him is he was a bakery truck driver.
Wow.
So he would get up at 2 a.m, all year round, and he'd be driving and delivering baked goods. So it was always dark for him. And with cataracts, that's one of the biggest things people come in and say, I can't drive at night anymore. I don't want to, I have to be home, or I'm changing my schedule because my vision's bad at night, and saying it's cataract surgery. Way back when I was a little kid learning all this, and they used to say, well, when it's ripe, and what do you pluck the eye? Right. I didn't get that. And now it's visual, if it's affecting your quality of life. And we have people that we've sent out, and we told them maybe 5-6 years ago, and they finally get cataract surgery, and they say now, they go, I should have had this done before. And saying it's a lot different procedure. Back when we were little kids, the procedure was 20 to 25 minutes long. You stayed in the hospital for 4 to 5 days, sandbagged, so you couldn't move your head. That's what it was back then. The procedure now, 7 to 8 minutes instead of 20 to 25. If you have to be at the surgery center or the hospital at 6 a.m, you're leaving at 8 a.m. They tell you, go home, have a nice breakfast, relax today. You can drive yourself to your 1-day post-op.
Oh, wow.
It's coming in that. And the kicker with this, the best thing, is the newest implant. So what they do is they take the foggy lens out of your eye, just like a foggy lens in a camera. If you get a camera, that's what you take that out and you put a new lens in. That's exactly what they do. They take that out and put a new one in. Now, up until a few years ago, that was just, they made your distance vision as sharp as they could, and you wore the little over-the-counter reading glasses, or you still could get bifocals with nothing in the top and just a little reader on the bottom. The newest ones adjust focus like you did when you were 19.
Nice.
Wow.
The rest of your life. So I tell people, you want to get it sooner than later, because you can take these and toss them, and you're 20/20 there, 20/20 here. And
Wow.
now most health insurances pay for cataract to remove the lens. They pay to put a standard one in. Okay. But the bifocal part or the multifocal part is a premium. So that's out of your own pocket. And that's anywhere, depending on the style that they say is best for you, is between $2,000 and $2,500 per eye extra. Okay.
Per
Now,
eye.
per eye, yeah. So I told that to one patient, and she goes, is that all? And I go, and she says she just had 1 tooth implant, $5,000 for 1 tooth implant. And that's, and I'm talking to other people, and they're all saying the same thing. Goes, if you hear about these tooth implants, and they go, oh yeah, I come over here and see it. They're $5,000. They said the same thing. And I said, do you know what that tooth was? She goes, what's that? And I go, that was your eye tooth, because you're going to have both eyes done for that tooth. It's like, and saying, so in comparison to doing something like that, if you wanted a tooth implant, it's reasonable that way, but it's still that way. So, most people are still getting, just give me that full distance. Or if you get something called monovision, when you wear contacts, they can fit one eye to see distance and one eye to see up close. And that works out pretty good too. So you have a couple options with that.
Yeah, that's what I have. I had LASIK like 30 years ago or 25 years ago, and I have my right ones for close and my left ones for far away. But I can still see out of the right for distance, but it isn't as clear, so. But it sounds very familiar, similar.
Yeah, I had the same thing. Like, it was 1998. I did the same thing, but I've gotten older, and so now instead of my near being here, it's way out there. So I do put these on just it gives me a little bit of balance. But it's interesting because I can wear these all day long around the office because
That's cool.
Mhm.
okay up close, but I can also do everything without them and still be okay with. So that's with the cataract surgeries. And you can still use, whether you've had cataract surgery or not, or implants or not, the Macu Health for the vitreous, you can take that, doesn't matter whether you have
Okay.
a implant or not. So that's all of that is fine. Okay. Now we've talked about the dry eyes before and doing that. The other two other things, did we talk about Lumify before?
I think we did.
So
Yeah.
this is over the counter for eye redness.
Oh, yep.
And people will say, well, I use Visine or Murine or Clear Eyes. And I tell people, you really don't want to use that. So the difference with this one is the other drops reduce the blood vessel size, so it's not as red. But they work to reduce both the veins and the arteries. Okay? Which will make your eye whiter. But probably about 90% of the time, it's the veins that are the problem, not the arteries. Well, if you reduce the size of the arteries, you're reducing how much blood's getting to the tissue, which isn't always the best thing to do. And they're more susceptible to you're going to have to use that drop all the time. You got to use it 2 or 3 times a day. And once you stop, it comes back even redder than it did before because those vessels will dilate even bigger. Lumify only works on the veins, not on the arteries at all. So there's no rebound redness with it. And that's available either in the non-preserved little vials or a bottle. And so if there's redness, and I tell people if there's redness, if it's irritation, you want to get that checked. But if it's just redness secondary to dryness, or hey, I'm going out tonight, I'm going to a wedding, I'm going here, flop a drop in, and your eyes will be, I mean, they're white for like about 8-9 hours. It works pretty well.
Can you use it? I use glaucoma drops, the Lumigan.
Yeah,
Can you
Lumigan.
use that? Can you use the Lumify if you're on glaucoma drop?
You can. I wouldn't use it all the time, but you can, again, if it's because the Lumigan, and brought up a good point, Lumigan, one of the side effects is red eyes. And that's one of the side effects, but hey, I'm going out someplace or getting together, a drop in is not going to harm that at all.
Yeah, I find when I first put it in, I keep them in the fridge when I use them. And I put one in each eye at night. But as soon as I do it, I have like a little bit of pressure, almost like a pain type of thing. I don't know if it's because I'm so dry that I don't think I use the eye drops enough that I should, the dry eye stuff. So
if it's a little pain or sting, you could put a dry eye drop in before, maybe 10 minutes before, then put your Lumify in. The problem with Lumify is it does sting and causes redness, but putting it in the fridge reduces the sting a little bit. So that's good. So you can use that. And the other thing besides dryness is, I'm not sure if we talked about this. Are there any other questions on the red eye drop? Okay.
Oh, I actually had another question. Oh, go ahead, Janet. You go
Yeah, I
ahead.
have a question on dry eye. I do the CPAP and it's a full face mask. And years ago, my insurance would pay for Bepreve and they stopped paying for it. So my doctor said either use Pataday, like once a day, or just lately I'm thinking that it's even cheaper to buy Zator by Sustain for allergies. But that's for allergies, for dry eye, for like a debridement of the eye from a CPAP. What's your suggestion on that?
Well, the Bepreve is really for allergies too.
Okay.
And so is the Pataday. And now the Pataday will go to that one. It's over the counter now.
Right.
And they actually have 3 of them. And the box has a little blue stripe or a red stripe or a green stripe. And each one's a little different strength. And I tell most people, go ahead and get the one with the red stripe that's in the middle. And you can use that once or twice a day. And saying, so for allergies, so that could do it. The Zaditor is one step just below that, but again, that's for allergies too. And saying, but it's a little step below that. And it's kind of like Zaditor, and then the Pataday is here, and Bepreve is just a little bit above that. But we've had a major problem with insurances not paying for the Bepreve anymore because they just said, go get the Pataday. So you have to try the Pataday, You have to fail at the pad a day. You got to come in. We got to document that you failed at the pad a day, and then send it in and send it for a prior authorization to see if we can get it approved. But some still don't approve it, and saying this is what they do. But
Yeah.
go ahead.
Does that also work for people that have glaucoma? My husband and I, we both have the May, June, July grass and tree pollen allergies. Would that work for him as well?
Yes,
Okay.
the pad a day, and that would be fine to take. Yeah, no problems with that at all. And
Good.
saying, so other drops, and now like for the dry eyes, I'm looking at still using the omega-3 now, the Ivizia that
Mhm.
I've started to use. We just got the samples in, and I like to get, but still the Systane, and with that's the Systane here that
Mhm.
they have, and the Refresh, it's called Refresh
Mhm.
Relieva.
Yep.
Mhm.
Is good. Besides the other ones are really, really good. A new one out in the dry eye. We just got these samples this week. It's called Natural Tears.
Hmm.
It's available over we just got the samples because they just made it over the counter,
Okay.
and they have a couple different levels of that. And so I've not even handed it out yet. Dr. Peck and I we just looked at it and put it in the shelves this morning. So it's that new on the market.
Yeah,
And
I've been using TheraTears for years. I mean,
Yeah.
it seems to work good for me. And it
Theratus
does
is another very good one.
And
Mhm.
I have fibromyalgia too. And I asked my doctor, Dr. Vincent Yu, and he said, really watch out. I mean, I know that you're going to wear the prescription, wear the eye coverage and everything but the sunshine really affected my eyes. And he says, be careful. A lot of that is just dry eye. It's not your fibro. He says it can be extreme dry eye. And I've had the plugs years ago, and I
Right.
was doing that vitamin that has the fish oil in it, and also flax oil is named, I might be a Preservision or whatever. It's an eye drop. I mean, a capsule. And I only take one of them a day, but I think you can take 2 of them a day for dry eye. What's your input on that one?
Yeah, for the taking a capsule oral is the
Theratear, I
omega-3
think it's called. Yeah.
Yeah, the omega-3 fatty acids are very good
Mhm.
for that. And it depends on whether you go with the omega-3s. There's 3 of them,
Mhm.
different omega-3s, 1 plant AHA, and there's 2 that are animal DHA and EPA, of which, and I tell people if you can get the animal-based, it's probably a little more potent. The vegetable-based, plant-based, it's about 70% effective.
Mhm.
So you got to take a little bit more of that to get up to the same level of that you're getting in. But I say anything you take is good. Now, the other thing is eating, it's cold water fish. So salmon, trout, if anybody likes sardines, are high in the omega-3s. But you can get the grapeseed extract. And that's one of the things in that new, the Ivizia drop they have, or the MacuHealth, they
Yes.
have some grapeseed extract in that too. So taking the vitamins for that, and I say the omega-3s are great for that. Also, they don't talk about it, but we've always done in the past a B complex for eyes.
Mhm.
That can help too if you take anything in the B. Is really, really good.
Does that affect our thyroids when we're on thyroid medicine, the B complex? Because a lot of the vitamins I'm shot down for and only take a half a vitamin because they're so worried about the B complex, whatever the
Right.
B's in it.
And it depends on what B's, because you get the niacin and saying you may want to talk to your physician about that beforehand,
Okay.
just to see if it's and how much is in that. If, but I'd say for right now, I'd stay with the omega-3s and say if you have any issues, which is good. Another one good for dry eye is they also have the Blink drops. Anybody used the Blink? And they have a lot of different ones. This one they have 3 levels, and this is severe, but they've come out with some really good drops. And like you said, the TheraTears has been really, really good in the past. And one other one we happen to be out of it is Retain, RETAINE. And that is a very good drop. It's kind of right up there with my omega-3 drops too. But they send us very few. They send us like 6 samples, once a month. I can go through 6 samples in a morning, and because the number of people with dry eye, and it's like, send us a bunch. And we are having problems with them with sampling now because of supply chain. and companies just are not sampling. It's, just tell them this and, well, they're going to spend, $20 for a drop that doesn't work, or, which one works better. Everybody's a little different.
Oh, wow.
So is Retain
know-
over the counter or
The chain is
prescription?
over the counter too.
Didn't they have like a recall on some eye drops?
Mhm.
That was my
from
next
certain
question,
companies?
actually. Yep.
Yes, and
Yeah.
here's the good news, it was not in Michigan. We don't have that drop in Michigan. So it was an over the counter. I was made in India, I think. And it was, again, it was an off brand. And that's why it's one of the things with drops, I say, stay with name brands. It's going to be, it was an off brand. And when I heard about it in my mind, I'm thinking it's either one or two bugs. And sure enough, it was one bug that you do not want to get in your eye. And I'm saying it's a very tough one to fight. And what's interesting is I guess there were 3 deaths or something like that with the drop.
Mhm.
And I'm thinking, you don't have a lot of systemic absorption from eye drops. There's very little, but they must have been putting in a whole lot of drops to get down through their canal and into their throat and whatever, or else they tasted it or something, or I'm saying that's a lot of drops for that to get in
Yeah,
there.
and some people, it was like 4 people that had to have their eye removed.
Oh, yes.
Or
Yeah, that was
blind or
a
something.
bonus. Yeah, you get that. and
Wow.
Yeah, if I see someone and I suspect Pseudomonas, I'm not touching it. It's going right out to the corneal specialist and
Wow.
saying you can handle that one, and saying it's a tough one to work with.
Mhm.
Once you open a tears bottle, when should you buy another one? Like how long are you supposed to keep them?
Great
Or
question. Most of them are about 30 days.
30 days, okay.
Depends.
Good to know, because
And that's where
when
that,
you're traveling and you don't have refrigeration, is there a problem with, okay, so I have an issue with my glaucoma drops in that I usually take an extra bottle just in case, but some places we go don't have a fridge. It's like, what do you do?
now the good news is the drop, the Lumigan or the Latanoprols that you have does not have to be refrigerated. It's refrigerated. We always tell people to do it just because it makes it sting less. It feels a little more comfortable going in. So when you put something cold in your eyes, you go, oh, that feels pretty good. And that's good. So if you're out for a little bit, it won't matter. It won't affect the effectiveness of the drop at all.
That's good. Yeah. All right. So 30 days. I'll have to probably get another bottle of tears.
That's usually what they're saying if it's preserved. And I'm saying you can also look at the expiration date, and they say 30, and I tell people, if you've really been taking good care of it, 2 months is okay.
Yeah.
So I usually use the individual ones.
Yeah, and
Is that good, or are the bottles better?
individual is wonderful because it's you're supposed to put a drop in each eye and then throw it away. And actually, the FDA has approved those for like 3 days, but they don't want to tell anybody. So I tell people, if you got a little bit in there, put a little drop in each eye. Just put it in a little Dixie cup. Hold it in this cup, and you can use it the next day, or you can use it. If it's glaucoma drop, you can use it the next day. If it's an artificial tear, you can use it up over the next couple of days.
Okay.
So
Oh, that's
way
good to know. Okay.
It's always fun to go to the seminars with the experts in the field, and at the end of the seminar, they say, "Thank you." The reps from the companies are there, and they always say, "Thank you, reps. You've done everything great for us. You're fantastic for everything you do. And I'm going to ask you now to do one of two things: either leave the room or cover your ears, because I got to talk to you about this." And they say those little caps you break off, don't throw them away. You put them to the side. They're good for a couple of days. Don't worry about it. And it's always kind of laugh. I said, "Yep, that's what I always tell my patients."
I think they do it because when you throw them out, you have to buy their product a lot
You have to
faster.
buy more, right?
Good point.
Yeah, and
They make more
again,
money that way.
Yeah, I talked to the reps about it, and it actually, there's in those little vials, it's more expensive to make the vial than it is for the solution inside the vial. So they just put more in. They used to, I mean, some of those vials used to, when they first came out, they were like, weeks worth of drops out of them, a couple times a day. And then they cut that way down just to make you buy more vials because they weren't selling enough vials. But we're not supposed to tell you that. So I didn't say that. Go back and edit that out of the recording.
Jeez.
Dr. Hodak, I think that's interesting. You mentioned about the eye drops and the time period. I think it's the same kind of thing on the Flonase products you put in your nose. I think I created myself a stuffy nose, but I know it's allergy season.
Mhm.
And I wanted to let you know that ENT specialist Dr. Lapoudre out of Oxford mentioned X-Clear to my husband, and that's like something that brings moisture to your nose and possibly your eyes. It's got xylitol in it, and it's a thing that it disposes. I think it goes between your nose and your mouth, and it's an unusual thing that you inhale, but it also helps with the dry eye and the nose.
Well,
That's Kroger
that's-
sells.
yeah.
What is
and
it
same-
called?
Yeah, what is it called?
It's called X-Clear, I believe.
X,
Is that-
like.
Yeah.
Is that over the counter?
Yeah, over the counter.
And saying what does clear the nose up, but your eyes drain to your nose drains to your throat, but the sinuses drain to the back of the nose too. So anything that goes in goes one way, it can go the other way too.
Yeah.
And we have and what's really interesting, another one is my granddaughter was having eye infections all the time, and that's very, very, very common for little kids. Their tear ducts are not as wide open when they're young, and the surgeons, the pediatric surgeons, want to wait till they're at least 1 year old before they go in and open up that duct. And sometimes they have to. Otherwise, we just put them on antibiotics and clean, and she was having all sorts of problems. So, but she was also having ear infections.
Oh.
She got tubes 6 weeks ago, no problems with the eyes. So what it was everything was backing up, and the pediatrician
Oh, wow.
told us that, yeah, we're going to hold off on sending it to the ophthalmologist. And she's down in North Carolina, so I don't even see it, but she's down sending it. She goes, because this might clear it up, and it certainly did. So it's all in there. So her ear infections were leading to her eye infections.
Wow.
Like I said, it's all interconnected through the sinuses. So
More kids in daycare, they spread things around.
Yeah.
'Cause,
All the time.
my two grandsons homeschool, and they hardly get sick, knock on wood. But my other two grandkids go to daycare, and they're always picking up something, pink eye or, upper respiratory things, it's like all the germs that are around. I guess that's good for immunity, but,
Right.
but,
I hate
Now,
it. I
kind of
hate
just-
it.
yeah, just on that little track, just it's off track, but
Yeah.
there was a study done in Norway, I think, and it was on preschoolers.
Mhm.
And they studied the kids in the city versus the preschools in the country. Unbelievable difference in sickness. The kids in the city, someone was always sick. They were sneezing. They did this and that, whatever. The kids in the country, they were outdoors every day.
that's,
So they were not
Yeah.
locked up in the room. They had all their toys outside. They actually even went out during the winter. Every day they went out. They went out when they were during the summer they taught the kids how to plant garden and grow food for them and flowers. And those